You need to be medically and psychologically fit to undergo transplantation. The transplant surgery cannot take place if you contract an infection, as this may put you at risk. Thus, it is important for the patient and family members to take the necessary precautions while waiting for transplantation and after transplantation.
The aim of vaccinations is to protect against certain infections. As your immunity is compromised, we also encourage annual influenza vaccination to keep the flu away. A chickenpox infection in transplant patients can be a serious condition. You and your family members should undergo varicella, also known as chickenpox, vaccination if you are non-immune. If you are non-immune to hepatitis A, hepatitis B, mumps, measles, and rubella, also known as MMR, you would also need to be vaccinated against these viruses.
Examples of live vaccines include MMR, BCG, polio, smallpox, and yellow fever. You should not receive live vaccinations after the transplant. We advise you to take precautions when coming in contact with family members who have been immunized recently with live vaccines. This is due to the risk of transmission of infection. You should avoid people with infections, especially individuals with active viral infections such as chickenpox, mumps, measles, mononucleosis, tuberculosis, colds, or flu.
You should stay away from compost piles, construction sites, decaying plants, fruits, and vegetables. This reduces your exposure to fungus and bacteria.
There is a possibility of exposing small cuts in the hands to potentially dangerous microorganisms. Hence, you should wear gloves to cover your hands when doing activities such as gardening.
You should wear covered shoes when walking outdoors. This prevents injuries and cuts, reducing the risk of exposure to microorganisms in the soil. Having a stress-free lifestyle is important to stay healthy. Do ensure you have adequate rest, regular exercise, and proper nutrition.
Practice good hand hygiene. Avoid touching your eyes, nose, and mouth if your hands are not clean. You can consider undergoing a tetanus vaccination to prevent infections from animal bites and exposed wounds.
You should not share personal care products and utensils such as razors, toothbrushes, spoons, and forks.
Practice safe sex using appropriate protection such as condoms.
Scan the QR code to download a copy. Do reach out to your physician or coordinator if you have queries.